Welcome to the ASCO eLearning Weekly Podcast, a weekly educational series focused on helping learners identify knowledge gaps and stay up to date with the latest in new drug developments, cancer treatments, and patient care approaches. This episode is complimentary to an education session presented at the 2019 annual meeting. For more detailed information about the education session, make sure to check the episode description for links to ASCO's meeting library.
Hi, my name is Dr. Amy Comander, and I'm a breast oncologist at the MGH Cancer Center and at the MGH Cancer Center at Newton Wellesley Hospital. I have a busy clinical practice caring for women with breast cancer. In addition, I have a strong interest in cancer survivorship, and my goal is to help my patients achieve their best quality of life after undergoing cancer treatment. In my personal life, I am married to another physician, and we have 2 children ages 9 and 12. Dr. Jimenez and I look forward to discussing with you how to avoid burnout in oncology and why this is important.
And I'm Rachel Jimenez. I'm a breast radiation oncologist at Mass General Hospital, and I'm also a program director at MGH for the Harvard Radiation Oncology Residency program. I, like Amy, have a busy clinical practice caring for breast cancer patients, and my research interests focus on the reduction of normal tissue toxicity associated with breast radiotherapy, as well as the ethics of cancer care delivery. In my personal life, I'm married and the mom of twin 4-year-old boys.
You have your hands full, that's for sure, Rachel. Well, it's great to do this podcast with you. I know when we were approached about doing this podcast on the topic of professional burnout, I think we both found this to be an exciting opportunity to explore this important area. But I know that neither of us particularly feel like experts on either burnout or work-life balance since we're still figuring it out ourselves.
Yeah, I think it's a constant process, but we've talked about, Amy, I think that both of us have experienced moments when we felt like we were working too much and spending too little time doing all of the other things that we're passionate about. And I think we've also noticed moments when work felt less gratifying and more tiring. But since we're both working mothers who love our jobs and who have lots of interests and responsibilities outside of work, thinking about burnout and how to prevent it is something we do all the time.
Yes, absolutely. We both know, unfortunately, from our colleagues' experiences and from reading about this topic, physician burnout is a common phenomenon, specifically amongst oncologists. And some papers report that 45 to 80% of oncologists may experience symptoms of physician burnout. I think it's important to really define what we're talking about, and there are many definitions out there. Dr. Herbert Freudenberg has defined burnout as a condition that occurs when work coupled with additional life pressures exceed the ability to cope, resulting in physical and mental distress. And unfortunately, I think at times in our careers, we've probably experienced symptoms like this. You know, our jobs are incredibly difficult. We are often caring for seriously ill patients and also caring for their family members who are in distress. And these are really tough experiences and can take a toll.
Yeah, I think there's so many examples in our working lives that show us why physicians can get burned out. We have long working hours. It's often really difficult to unplug at the end of the day and put the technology aside to focus. And then we have increased documentation requirements. We have compensation models that are changing, and there's just so many logistics to the practice of medicine that have the potential to burn us out. And I think, as you said, it's particularly challenging in oncology because we do have a responsibility to be emotionally present and to counsel patients and families through really serious and sometimes heartbreaking situations, and that has its emotional toll.
Yeah, absolutely. Yeah, I mean, we're in a very rewarding field, but it's definitely very difficult at times. And I think another important factor as we focus on this topic is that there are certain, specific factors that may predispose physicians to experience burnout. And unfortunately, some of these factors apply to us. Being female is a risk factor. Having a young family is a risk factor. In addition, something that you've experienced with, Rachel, being in medical training can also be a risk factor for burnout, such as folks who are still in med school, residency, fellowship. Those are all really tough times. So these are risk factors that we need to keep in mind.
We try to be really aware of our trainees as they go through their medical training, that we try to identify signs of burnout and try to come up with ways to prevent it. And that's something that we're always on the lookout about, even as we're trying to manage our own burnout.
Absolutely. It's so important to focus on those factors. And specifically, there's really 3 areas that, one should look for in a colleague if you're concerned about burnout. And the first one is physical and emotional exhaustion, which unfortunately happens a lot in our jobs. As you mentioned previously, working on the electronic medical record late at night and always available on our phones. And it can really take a toll in this field because we want to be available to our colleagues and our patients and their families. And it can be really tough. A second factor is increased feelings of cynicism. And I think, certainly we've all experienced, either our colleagues who are demonstrating this or maybe feeling it ourselves. And certainly this is something to look out for as a particular domain of burnout. And then finally, the feeling of being ineffective, that, there's only so many things you can do in your job. And sometimes it just seems like insurmountable. And this is definitely a specific, factor that should be a red flag that someone might be feeling burned out.
Yeah, and I think that when physicians experience symptoms of burnout, as you mentioned, as so many do, there sometimes can be really serious consequences of that because we know that when physicians get burned out, they're more likely to abuse alcohol and drugs. They're less likely to take care of their health, which means they're more likely to develop a chronic illness like diabetes or obesity, and in some cases can become very clinically depressed. And so if that's not addressed and managed, we definitely know that there are reports of physicians who are committing suicide. So this is a really serious issue, and I think that some good news has come out of all of this, which is that I think that hospitals and hospital leadership and physicians themselves are increasingly taking notice of physician well-being. We want to try to prevent some of these things from happening.
Exactly, to kind of bring awareness to this topic.
Yeah, and so I think one of the things that you and I wanted to talk about was some strategies that people could use to help resist burnout.
Absolutely. It's so important. And I think one thing to think about is just that there are things we can control in our work environment that can help prevent burnout and improve resilience. And one key thing that I know, Rachel, you and I have benefited from is a great peer support group. And certainly at MGH, we've been really fortunate to be part of a Women in Oncology group. And, we've been meeting regularly for social events, but also occasionally inspiring talks, and we've been able to provide support to one another, whether it's things at home or career advice, and I think it's been really helpful to have this community for support. Another really important factor is self-care, and I know we've both discussed this as well, and that means different things to different people. For me, that's going for a run. For other people, that might mean getting to that yoga class or getting home in time to take your kids to the park. There's so many different ways we can, focus on self-care, and I think it's really important for us to do this in order to, retain focus on our well-being.
Yeah, I absolutely agree. And I think more than just the kinds of things that we can enact for ourselves, I think interventions on behalf of the institutions in which we work is also very important. And I think that this can come in lots of different forms. As we've seen through our own experience, it can be something like just increasing the flexibility of work hours or making other changes to the work environment to make it more efficient. So some hospitals have introduced medical scribes into patient rooms, and this can help reduce the burden and time associated with documentation. Other hospitals have experimented with changing the hours of clinic to include an evening clinic, and maybe that helps provide daytime flexibility to working parents. But it certainly requires an investment on the part of the institution, and sometimes the institution might need a little bit of extra prodding from groups or from individuals to make that change happen.
Absolutely. I definitely agree with you. And I have an example from, my own hospital, Newton Wellesley Hospital, where I've been working the past few years, and I was able to participate in the Benson Henry's Institute Stress Management and Resiliency Training Program. That was a mouthful, but this was developed about 40 years ago based on research in the field of mind-body medicine. And the goal of this program is really to provide participants with strategies from the field of mind-body medicine to promote health, well-being, and resilience. And this program was offered to physicians to help prevent burnout. And I'm really fortunate to have the opportunity to participate. And I hope it helped me. It was definitely wonderful to learn all those tools.
Yeah, and I think it's incredible to have those kinds of options for physicians available. I know one of the other options that we've seen through our physicians organization is that they recently implemented providing free exercise classes for the physicians at a nearby cycling studio. It's wonderful. It's been really popular. It provides a way to be active and to also do that with colleagues. And so then you're building in a social network. And so I've definitely taken advantage of that. And there's lots of other things that I haven't even yet been able to take advantage of, but that I think are really helpful. We've heard about peer coaching and other types of intrinsic networks that have been built within the hospital where physicians get to help each other. And I think that having the institutional support for those programs is so valuable.
Absolutely. I'm so glad you're taking advantage of that too. It's really just a great resource. So before we close, we wanted to just really focus on 3 things that one can do to actively resist burnout. Why don't you go first, Rachel?
Yes, to reiterate what Amy said before, I think number 1 is just about self-care and making sure that you get peer support and surround yourself by a community of people who want to see you thrive and do well. And that means also taking care of yourself, looking to do the kinds of things that you value, whether it's exercise, whether it's spending time with your family.
Definitely, so important. I guess I'll give an example from how one can sort of set work boundaries. As you noted earlier in this podcast, we're always available, whether it's over email or from our phones or on the medical record all the time. So it's really important to find a way to set boundaries, and that's going to be different for each person. I know for me, when I get home from work, I put that phone down and I'm present with my kids, and I'm happy to be engaged with them and talk to them about their day, and as much as possible try to ignore emails that I'm receiving. And certainly it's a challenge, but I think we all need to try to establish some boundaries to have more balance, and this is still a work in progress, I know, for me and probably for you too.
Absolutely, yes. But I think that second point of trying to self-impose work boundaries is so, so valuable. And I have done the same thing. I just put the phone down, and until my kids go to bed at night, I'm not checking email or looking on my phone. The last thing is just, again, really trying to advocate and insist on institutional or departmental support so that you get the external support that you need to make sure that if you are feeling burnout, that there are ways that you can try to mitigate that. And I don't know if you've had experience, Amy, from an institutional level on things that have been done at Newton Wellesley Hospital to try to limit that for physicians.
Right. I mean, I think there's ongoing efforts to address this, since certainly our hospital is also recognizing that this is a really important problem that we need to address to ensure that physicians continue to function and feel well and restore that joy to medicine, which is really key. Yeah, well, thank you all for listening today. Rachel and I know that physician burnout is a major challenge in oncology and in radiation oncology, and so this will require ongoing attention to address properly. But we hope we've provided some helpful information and some simple strategies that you can put to use to help balance your professional and personal lives.
Thank you for listening to this week's episode of the ASCO eLearning Weekly Podcast. To make us part of your weekly routine, click subscribe. Let us know what you think by leaving a review. For more information, visit the Comprehensive eLearning Center at elearning.asco.org. The purpose of this podcast is to educate and inform. This is not a substitute for medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.